The collapse of the healthcare system does not present itself with only destroyed hospitals and destroyed ventilators and patients who are dying in the hospital. We've seen all of that, by the way, in Gaza. But it manifestates itself by outbreaks.
That was Dr. Zahir Sahlul, who witnessed the collapse of the healthcare system in Gaza.
When you start to see outbreaks, that means the collapse is really, really bad. That means when you see one polio case, this is the tip of the iceberg.
Children's lives in Gaza are riddled with uncertainty and fear. They don't know when the next bomb will fall. They don't know where their next meal will come from. They sometimes don't even know if their families or friends are still alive. And now, another variable poses a grave risk to children: polio, after a baby as old as the war in Gaza tested positive for the disease. At least 2 other children are suspected to have it too, and their parents are anxiously waiting for their test results. But humanitarian groups have been talking about this for weeks after poliovirus was found in 6 sewage samples last month. To put how dangerous this is into context, polio was declared eradicated in the occupied Palestinian territories. The same polio which causes nerve damage and can lead to irreversible paralysis. Doctors, aid workers, and even Gazans themselves have told us that they had never seen anything like what's been going on in the past 10 months in terms of the scale and depth of trauma, suffering, and destruction. Thousands of tons of garbage continue to pile up. Sewage is collecting in the streets, winding through tents where hundreds of thousands of displaced Palestinians have sought shelter. Let me remind you that at least 90% of Gaza's population of 2.1 million people have been displaced, and the figures are thought to be even higher with the absence of proper data collection methods. Water and sanitation services are extremely scarce, and the healthcare system has collapsed, with not a single fully functioning hospital available in the entire Gaza Strip. Aid groups have been saying that more people are likely to die from disease in Gaza than of airstrikes. Warnings about the spread of disease appear to have fallen on deaf ears. After 10 months of the war, conditions have become so dire, making an already vulnerable population more susceptible to all sorts of illnesses, preventable ones too, with polio being the most recent and arguably the most dangerous. The World Health Organization, along with UNICEF and other aid groups, have called for a ceasefire or at least a pause in the fighting, just to be able to administer a vaccine campaign for 640,000 children under the age of 10. But will this happen? This is Beyond the Headlines, and I'm your host, Nada Al-Tahir. In this week's episode, we consider the gravity of a looming polio outbreak in Gaza, and we ask, what will it take to stop the disease from spreading before it's too late? Dr. Zahir is the president of the US-based medical NGO MedGlobal. I asked him what makes a single case of polio so concerning.
We've seen this movie before in neighboring Syria, where you had initially one case because of the war. And then after that, we had several cases. And we had to have a major vaccination campaign that included 8 different countries and the millions of children to prevent this from spreading. So one case means that this is the tip of the iceberg. So right now we have confirmed one case and the 2 other cases that are being investigated to check if they have polio. These 3 children had presented with acute flaccid paralysis, which is the hallmark of polio. But if they are confirmed, that means there are other children who may be harboring the virus and don't have symptoms, because only 1 out of 200 children who contact the virus will have symptoms. And then other children will be prone to have the same condition. And paralysis related to polio is irreversible condition. It's not curable. It will lead to lifelong disability and sometimes death. So that's why it's a dangerous disease that the world is trying to eradicate for the past few decades with a lot of success. But right now we have only a few hundred polio cases in the world every year in areas with low vaccinations or in areas that are in a conflict like in Gaza. So that's why one case is too many.
What are the kind of conditions that are required for polio to re-emerge, especially in Gaza 25 years after it was declared eradicated?
In order for polio to resurface, it has to be introduced into a country that the polio has been eradicated. So Gaza did not have any cases in polio for the past couple of decades because of the successful vaccination campaigns. Gaza is a success story in terms of the healthcare system before this war. So two requirements. The first one is collapse of the healthcare system. That means decreased vaccination rate, and also shortage of personal hygiene and pollution of water, and then introduction of the poliovirus from other sources. There are studies that were done on the virus that were detected in the sewage in Gaza that showed that this virus was introduced from Egypt early in 2023, and that now it's spreading. That's why we have these cases of acute paralysis because of the low vaccination rate, and also because of the displacement, because of the pollution of water, because there is no enough clean water, because of the contamination of food. Polio is one of these viruses that can transmit from mouth, from polluted water, from polluted food, and then can cause the flaccid paralysis.
Anecdotally, I've heard from other doctors saying that when foreign doctors visit Gaza and finish, their trip there, some of them would choose to burn their clothes before leaving for fear of spreading diseases outside of Gaza and back home to their countries. So, what is the wider impact that an outbreak of polio would take place in Gaza?
Well, when I was in Gaza, and I've been in Gaza 4 times, 3 times before this war, and one time during this war in January, I spent there 2 weeks. I stayed in Rafah and I worked in Nasser Hospital in Khan Yunis and also in a clinic in Rafah that is run by my organization, Global. It's important to describe the daily life. So when you move in Gaza from place to place, the first thing that will attract your attention is tents everywhere. So 90% of Gaza's population have been displaced, and many of them multiple times. So this continuous displacement, that means you are disconnected from access to healthcare. Then you have destruction of water, of sewage system, of decontamination system. That means, and you are crowded and with many people where you have piles of garbage around you. So that's by itself spread is the fertile ground for spreading of diseases. Then you have very limited resources in the hospitals and the clinics. And then you have also closure of hospitals because of the destruction and the targeting of healthcare system, the bombing and the missiles that is targeting hospitals. So only 16 out of 36 hospitals are now functioning or partially functioning in Gaza. Then you have the healthcare workers themselves being under attack. So if you're a doctor or a nurse, you are displaced like everyone else. Many of the doctors I worked with lost several members of their family because they were killed or injured. So this is the daily life. When you have a condition that is very transmittable, poliovirus, like many other viruses, it can spread from place to place, from person to person. It does not only affect the population themselves, but it affects the population around Gaza. That means people in Egypt, people in Jordan, people in Israel can be affected, and the virus can be transmitted, and that will lead to an outbreak that is beyond the population in Gaza only.
How useful is it to actually vaccinate people after the first case has been detected? And how useful is it to vaccinate people without fixing the sewage systems and the infrastructure and providing people with consistently and continuously clean water?
Vaccination by itself is not the solution. And in order for vaccination to happen, as you know, there needs to be a security in the places. For example, we have 16 medical points in MediGlobal. Two of them were designated as vaccination centers. In order for vaccination to happen in these medical points, these are clinics run by local doctors. That means population have to be safe in order to come to the clinic. They need to be stable. That means they're not displaced from place to place. And we need to have supplies, the vaccine in cold chain. That means the vaccine has to be in a refrigerator so it does not expire or ruin. So these three conditions are right now not available in Gaza. And the second thing, you need to reach population that are not reachable right now. They don't come to the clinic. You need to go to them from tent to tent, house to house. You need to use mobile clinic. You need to have fuel, you need to have transportation, you need to have safe conditions. So these teams are not bombed, and these conditions are not right now available. That's why we are calling for humanitarian pause or ceasefire. So that way we can do the vaccination campaign. In addition to this, as you've mentioned, we need to have clean water, we need to have sewage treatment plan. So that way the conditions that are leading to the spread of the virus, because it's transmitted by contaminated food and contaminated water, then are not present. We need to train the staff on how to detect polio, because this is not something that doctors and nurses are dealing with on a daily basis. We need to have proper surveillance. So we need to have, as we mentioned, clean water, clean facilities, hygiene kits that are prevented for some reason from getting into Gaza. So all of these conditions are not there, security and safety and humanitarian pause. But we need all of that in order to have successful polio so it does not spread within Gaza and beyond Gaza.
There are children that have been born in the beginning of the war, so they've spent 10 months unvaccinated. If the war continues and if there wasn't a humanitarian pause or a ceasefire, are we going to be having the same conversation a year from now about polio, about other diseases?
When we're talking about vaccination rate dropping from 99% to 90, that means you have at least 200,000 children who are not vaccinated. 200,000 children who are prone to have diseases. So that's why it's important to understand the scale of the issue and the problem. On top of that, then you have malnutrition among children. So many children have malnutrition that will cause suppressed immunity. That means your body is less likely to fight infection and you're more prone to have infections. And this is going on in tens of thousands of children in Gaza. 500,000 Gazan Palestinians in Gaza have the highest level of food insecurity.
We have been speaking to humanitarian agencies who have told us about numerous incidents where entire trucks of medical aid are turned back because one or two items do not meet the requirements of the border police. Does Met Global have any similar experience with that?
It's a difficult question. What I know that we have difficulty getting supplies and we go through a very extensive process of clearance. You have to tell them in advance what are you sending, whether you are sending them through Egypt before the closure of the Rafah border crossing or now through Karam Abu Salim or Erez. We had many incidents that even with the clearance that our supplies were returned. So I'll give you an example. So we 6 months ago we had a shipment from the United States of medical supplies, means dressing, tubes for patients, for different catheters, suture kits, things like that, ventilators, hospital beds. And it contains also oxygen cylinders. So we sent them more than 7 months ago the list of the supplies, and they said it's okay. We send it to Egypt, stayed in the warehouse. We get to the border, and they told us we cannot let it in because it contains oxygen cylinders, even though that they approved the shipment. So they did not only return the oxygen cylinders, but they returned the whole shipment, including things that are not sensitive or of dual usage. So these things, unfortunately, it has been happening frequently. And right now, the restrictions on medical supplies and surgical supplies is even worse than few months ago, despite of the whole kind of attention about increasing aid and supplies. It's more restricted.
Did other doctors, did other NGOs see this moment coming, this moment of polio emergence in Gaza?
Definitely. I mean, this is what we have been warning the world, and not only, of course, Med Global, but the WHO, the UNICEF, the UN agencies, the other NGOs that are working in Gaza. Again, when you have a collapse of the healthcare system related to the targeting, related to the displacement, related to the limited supplies, you expect viruses and infections to spread, outbreaks to spread. When I was there, I saw many patients with hepatitis A is related to contaminated water. It's actually the same transmission of polio, caused the transmission of hepatitis A virus. But if you have enough vaccination for polio, that will prevent the children from getting polio. In hepatitis A, there's no vaccine, so it's easier to spread. So we saw the initial signs that there's something going wrong. We also have seen other cases of measles that is related to the failure of the vaccination system. So you have many cases of measles in Gaza right now. And these are not as dangerous, these two diseases are not as dangerous as polio. because they are self-limited. They do not cause death in many, unless they have severe cases, and they do not cause irreversible paralysis like in polio. But when you see hepatitis A, when you see measles, that means something else will be coming. Everyone knew that polio will be coming because you are seeing many cases of these conditions. It's a matter of time. And now it's the time, unfortunately.
WHO officials say it's possible the disease has been circulating in Gaza since last year. Before the war, Gaza had a 99% routine vaccination rate against the virus, but now that number has plummeted to about 86%. This falls well below the coverage rate needed to contain an outbreak. UNICEF Chief of Communication in Palestine, Jonathan Cricks, tells me about the vaccination efforts to deliver at least 1.2 million doses to Gaza in the coming weeks.
It is important to keep in mind that for this vaccination campaign to be a success, we need to have more than 95% of the children who will be vaccinated, so that the vaccination coverage will be sufficient. The vaccination campaign that UNICEF, WHO, and the different partners will do in the coming weeks is very much addressing a specific strain of polio. It's called the type 2 poliovirus. And this strain was eradicated in the 90s. And since then, the oral polio vaccine that was used was actually targeting polio type 1 and polio type 3 strains. So what has been done in terms of routine immunization in the past years and in the past months in Gaza Strip is mostly vaccines against the type 1 and the type 3. Unfortunately, in June, WHO and the Ministry of Health and UNICEF have found traces of the polio type 2. And this is the specific type that needs to be addressed. And this is why this vaccination campaign is taking place, specifically for the polio type 2.
UN agencies, the Palestinian Ministry of Health, and other partners are working together to mobilize 708 teams on the ground to administer the vaccines.
It is absolutely critical that we are able to vaccinate 640,000 children below the age of 10 in the coming weeks in the Gaza Strip. So the process is that UNICEF will bring the cold chain supplies and the vaccines in the coming days inside the Gaza Strip. They will be stored in a warehouse in Deir el-Bala, and then they will be dispatched into 11 health facilities throughout the Gaza Strip, which are equipped with a cold chain capacity. And then people will be able to get vaccinated in those health centers, but there will also be mobile units that will be vaccinating people in coordination with the Ministry of Health, with UNRWA, with WHO and other partners to be able to vaccinate those children on the ground. The first round of the vaccination campaign will take place end of August, beginning of September for 1 week. And then there will be a second round of that vaccination campaign that will take place end of September, beginning of August, also for 7 days.
The Israeli army stated that its COGAT agency, which coordinates civilian matters with Palestinians, will facilitate the entry of more than 43,000 vials of vaccines into Gaza in the coming weeks. But under the current conditions of war, safety concerns, and lack of accessibility, aid organizations say it's impossible to conduct a vaccination campaign thoroughly.
The issue that we are facing is the fact that in the context of war, when you have the bombardments, but you also have the insecurity on the ground, you have access restrictions, you have also the health system which is only partially functioning. You have so many hospitals which are not working, which are not functioning. So all this is, of course, making the routine immunization way more complicated, way more difficult. And it is true, and it's also a big concern, that for other illnesses, many of the babies which are born are not receiving the routine vaccines that they should get to be protected. So the poliovirus is extremely contagious, especially when it's carried by a human being. So when it's not found in the environment, but carried by a human being, the poliovirus is attacking the nervous system of the human being, and it can create acute flaccid paralysis. And there is very little treatment to address this.
A report released by Oxfam in July found that Israel's military campaign in Gaza has damaged or destroyed 5 water and sanitation infrastructure sites every 3 days, and destroyed 70% of all sewage pumps and all wastewater treatment plants. In the very first few days of the war, Israel had also cut off external water supplies, causing an extreme water scarcity. All of this has contributed to more than a quarter of Palestinians in Gaza falling severely ill from easily preventable diseases.
The more than 10 months of war that we have been witnessing in the Gaza Strip is, of course, leading to many challenges and concerns. The lack of water, especially for hygiene, the lack of sanitation, the many times people have been displaced, the living conditions, the fact that many of the people in Gaza are living in tents where there is absolutely no infrastructure, no toilets, no latrines. The heat, the level of destruction, the fact that there is no sewage system, that there is no wastewater treatment system. All this is, of course, raising high concerns when it comes to the spreading of diseases. And it is absolutely critical that everything is done in order to address that. And ultimately, the only way to address that at scale is a humanitarian ceasefire. This is the only way to put back together a proper health system, functioning water distribution system, or any of the things that are absolutely needed to prevent the spread of diseases. And this is the reason why, for months now, humanitarian actors on the ground have asked for a humanitarian ceasefire to be put in place in Gaza.
That's it from Beyond the Headlines. This episode was produced by Ban Barqawi and Arthur Edison. Yasmin Al-Taji is the assistant producer and Dua Farid is our editor. And I'm your host, Nada Al-Tahir. Thank you for listening.